Dr. James Smith joins us now live from Amman. He's an emergency doctor and also lecturer in humanitarian policy at University College London. Welcome to the News Hour, Doctor. So you've been to Gaza before, and you're trying to enter Gaza from the Jordanian border for solely humanitarian purposes. Talk to us about the challenges that doctors and medics are facing right now who want to enter Gaza to help people there.
Well, for a long time now, there have been profound limitations on the number of people who can enter Gaza as part of the wider humanitarian system. But there have also been profound limitations on the number of critically injured people that can enter or leave Gaza for treatment that is now no longer available inside the Gaza Strip as a result of the systematic decimation of the Palestinian healthcare system by the Israeli military. So you have a situation now wherein the ability for people to enter to provide support to our Palestinian colleagues, and indeed the ability for people to exit for the purpose of receiving life-saving treatment is dramatically diminished.
And, of course, we're reporting on the fact that some aid is coming in, but nothing has come in, no aid, no medical care for 11 weeks since March the 2nd. Give us a sense of the scale and the urgency of the medical needs right now.
I mean, what we're discussing here and what your colleague Ashraf has described very clearly is the cumulative consequence of global inaction over the course of 593 days of an escalating genocide, 81 days of a total blockade of the Gaza Strip, with the exception of minimal movement of aid trucks in the last 72 hours or so. Initially 5 trucks, we believe, on Monday. That increased to just under 100 trucks that entered on Wednesday. That on its own falls far below the minimum number of aid trucks that should be entering Gaza, given the scale of need at this stage. The IFRC have estimated that somewhere between 1,000 to 1,200 trucks should be entering every day. Of course, once those trucks are inside Gaza, 65% of the Gaza Strip is now subjected to forced displacement orders or is under ground occupation by Israeli occupation forces, which of course makes it exceptionally difficult to get that minimal amount of aid to the people that need it the most. And of course, some of the areas most affected and still heavily affected by ongoing Israeli violence are in the northern governorate of Gaza. And
the death toll has been, especially last week, around 100 Palestinians killed every single day. What does that mean for the doctors and medics in the hospitals? What are your colleagues telling you about the challenges they're facing there in the Gaza Strip?
I mean, we have a trifecta, really, a deadly trifecta of extreme Israeli violence, at the same time the deprivation of the means simply to survive, and thirdly, the destruction, the targeted destruction of infrastructure that is required to sustain life. And that, of course, extends to the healthcare system. Our colleagues are continuing to adapt and to provide care with whatever means they have. But hospitals, again, particularly in the north, have been besieged and targeted in recent days. Kamal Adwan, Al-Ahli Hospital. It's a perverse state of deja vu, wherein we're seeing the same healthcare facilities, our same colleagues targeted over and over again, flagrant breaches of international law. And despite a slight shift in political positioning at a global level, ultimately the conditions that the Palestinian people are subjected to haven't changed in any tangible way whatsoever.
Dr. James Smith, thank you so much for speaking to us today here on the News Hour. We really appreciate your time and also that first-hand experience. Thank you very much, Dr. James Smith.